Cardiovascular Experts is committed to bringing peripheral artery disease symptoms to light. Too often, people experience foot or leg pain and assume it to be orthopedic in nature, when in reality, it could be an underlying issue. Dr. Raj Dave, founder and CEO of Cardiovascular Experts, is with us to talk about PAD. Thanks for being with us.
Thank you.
So explain to us, what is peripheral artery disease?
So peripheral arterial disease means that there is a buildup of plaque which leads to a blockage in the arteries that supplies the legs. It can also occur in the arteries that supplies the brain, such as carotid arteries. It can affect people's arms and the kidney arteries, and that's what's coined the term peripheral arterial disease.
So why is PAD often misdiagnosed?
Yes, so PAD symptoms typically occur in elderly population because this is a disease of the elderly in general. However, it does occur in some patients, those who are young and diabetics. And most common symptom is when patients starts walking, they have discomfort in their legs. However, many people think that the pain that occurs in the legs is due to hip arthritis or knee arthritis or old age or fatigue or sometimes nerve damage. And they're being seen by many different specialists who don't necessarily are expert in diagnosing peripheral arterial disease. And that's one of the most common reasons why PAD is often misdiagnosed.
Sure. Talk to us about treatments. Once it is diagnosed correctly, how do you treat it?
The most common treatment today in America is what we call endovascular revascularization. A lot of your viewers are familiar with a word called stent. Stents being used for many different circulation. The stent is also being utilized for treatment of peripheral arterial disease. It's basically a metal tube that keeps the artery open. We also utilize other technologies such as balloons. We also have some different technologies such as laser to pulverize the plaque. So there are many technologies, but they are all being done through a small needle hole. 99% of the time, these procedures are outpatient, so you come in and on the same day you get discharged. So the treatment is really very easy.
Wow, that's certainly good news. So how can patients find out more about your practice?
So they can certainly call us. Our phone number is 717-727-0480, or they can go to our website, which is cardiovascularexperts.com. If any of your viewers are having symptoms related to leg pains or anything else that they may have concern about peripheral arterial disease, they can certainly call us, and we'll be happy to help them with screening. Sometimes that's all what's required, or a very simple test like an ultrasound that can really diagnose peripheral arterial disease very quickly.
Dr. Dave, thank you so much.
Thank you.
Thank you to Deborah. We'll have more from Cardiovascular Experts a little later, but we want to thank them for sponsoring that segment. We'll be right back.
Earlier in the show, we talked with Dr. Dave about peripheral artery disease and how it can be misdiagnosed. This time, we're talking about the importance of second opinions. Mark Hostler is one of those patients who went for a second opinion when he developed a staph infection from a surgery he had received. Mark joins us now. Thanks for being with us.
You're welcome.
So you were diagnosed with PAD. What kind of symptoms were you having?
I had trouble walking. My legs would, they were like I would get knots in my calves, that sort of thing, where, I was not very mobile.
And when did it start and how long did that last?
Well, it would depend on how active I was, and it would pretty much debilitate me, and I'd have to stop and rest, and then I could start again, but it would do the same thing.
And I guess how long did that go on before you did something about it?
I've had probably over a dozen procedures in my legs. My left leg has an artery for my right leg, so I have a bypass in my left leg, and The right leg is the one that I was told a little over a year ago that there's nothing more they could do for me and that I had to lose my leg.
Wow.
And that's when I was told by my home nurse and my podiatrist to get a second opinion, which my podiatrist put me in the direction of Dr. Dave. And he is a cardiologist also, and he was taking over the practice of my previous cardiologist who retired. So not only is he a cardiologist, he's a vascular surgeon. So cardiovascular experts.
So you went to see him. So what did he say?
He said that we're going to do everything we can to save your leg.
Wow. How did that make you feel?
Well, I finally had some hope, and it came to fruition. I mean, here I am. I have no assistance to stand here. I walked up here myself. So.
And so what did he do?
He performed procedures on my leg. Of course, I like to watch, but they put you to sleep. And it's a true story. 7 days from the time he did the procedure on my leg, I set my crutches down, and they're probably still at the same place.
Wow.
And this is a true story.
How does that make you feel?
I mean, 68 years old. I mean, I wouldn't be, as happy as I am now if I couldn't walk. I mean, they were talking about, putting a fake leg on and all that. So
Wow.
I still have my real leg.
So what has life been like now?
Well, pretty good. I mean, I'm able to do the things that I did before. Of course, as the older you get, the least you can do. You can't do as much, but I get along. I get around.
Well, good for you. Mark, thank
Thank
you
you.
so much for sharing your story with us.
You're welcome.
Thank you to Deborah for that interview. Also, thanks to cardiovascular experts for sponsoring that segment. We'll be right back.